Hello again. Welcome to the COVID-19 weekly update from the city of Fredericksburg. I'm Mike Jones, Fire Chief and Emergency Manager. Let's talk a little bit about the statistics first. Unfortunately, our metrics are headed in the wrong direction. Probably a combination of the holiday season and people getting together, both vaccinated and unvaccinated at the holiday of Thanksgiving. Our numbers are going back up in the area. The latest statistics from the Rappahannock Area Health District as of this morning show a 7-day rolling positivity of 12.9%. That's almost 13%. That's up probably about 3% in over a month. So the numbers are headed in the wrong direction. And unfortunately, when we were down about 3 weeks to 4 weeks ago, down to 40 people in the hospital in the health district, we're now up to 74. So again, seeing more hospitalizations, more severe illness, and more cases of COVID in the area. The Delta variant is still the primary variant in the Commonwealth of Virginia. Omicron is present as of last week in the Commonwealth, but it is not the main driving force. The Delta variant is still the main driving force. And as expected, we are starting to see some breakthrough infections of people that are having COVID and some severe COVID with people that are already vaccinated. Although that's a very small percentage, it does occur and can occur. Looking at some other statistics that we have and things that we look at, we've had increased the number of people in the hospital by about 19 over the last week and a half. So those numbers are going up as well. And deaths are slow. That's good. We don't want to see anybody die from this, but the numbers do increase, but very slightly compared to what has happened in the past months and things like that. So that's good. For the city of Fredericksburg itself, our percent positivity is at 8.57% as of last week. So we're kind of leading the region as far as the least amount of positivity. That's a good thing. And also our number of cases are the least in the region, as we had 7 last week, and we'll probably pick up a few more over the weekend. So we've got to look at those numbers. But those are positive numbers right there. So let's talk a little bit about Omicron, because that's on everybody's mind. They see it in the news every day. They want to know what's going on. So it is out there. And to tell you how new this variant is, think about this. It was identified in South Africa, in one of the countries in South Africa, back on, I believe it was November 24th, 2021. So that's only about 3 weeks ago. And that was from a sample that was taken on Veterans Day, which was November 11th. And then right after that, the WHO and then the CDC declared it a variant of concern. And now we're starting to see it in at least 30 states in the United States. 30 states of the United States have Omicron variant here. So it does travel pretty quickly. It does spread pretty quickly compared to how quickly it spreads versus the Delta variant. They don't know. There's just not enough data out there. Right now, it does not appear to be causing as major sickness or a number of hospitalizations, but that's yet to be seen because the data grouping or sample size is so small. So we're looking at that, but it is out there and you have to be aware of it. Again, the best prevention methods against any form of COVID-19 is washing your hands, getting a vaccination if you haven't been vaccinated, and if you've been vaccinated and it's more than 6 months since you've had your 2-shot dose or more than 3 months since you've had the single dose, go ahead and get a booster. They're available out there to anybody, and the Pfizer vaccine for boosters is now available from 16 up. So definitely go get those. And then on an indoor setting, wear your mask. Everybody has them now. Shouldn't have any problem getting a mask. I know a lot of people don't like to wear them, and I understand that. But wearing that mask indoors, especially when ventilation is poor and as we move inside with the colder temperatures outside, it's very important to do that. Let's talk a little bit about testing and a little bit more about vaccinations. Testing is available in the region. You can go to a CVS or other pharmacies that are in the region out there and get tested. They do have test kits there. They can do the PCR tests. You can go by one of the test sites. The one in the city of Fredericksburg is on Thursdays. The test site is a drive-through test site at the Bragg Hill Family Life Center, 400 Bragg Hill Drive, up on the top of Fall Hill. That is a test site for COVID-19 testing, and that is available from 2 to 5 p.m. On Thursdays. If you want to get a vaccination, again, you can get those at local pharmacies, you can get them at urgent care centers, you can get them at your primary care physician, or you can use the community vaccination clinic, which is at 1877 Carl D. Silver Parkway in Central Park. That is available out there. I've been out there. They move you through pretty quickly. There's usually not a whole lot of waiting, so take advantage of that. That's open from Tuesdays through Sundays from 10 a.m. to 7:30 p.m. Let's talk a little bit about the flu. A lot of people want to get a flu vaccine now as they start to get into the colder winter months when they think about the flu. That is available from 6 years or 6 months of age up, and that is available at the Fredericksburg Health Department from 8 a.m. to 4:30 p.m. on Tuesdays. So that's Tuesdays, 8 a.m. to 4:30 p.m. at the Fredericksburg Health Department. And finally, if you need a rapid test, an antigen test, those are available and kits are available through the Central Rappahannock Regional Library. Please go to their website and look for the location nearest to you and the availability of those test kits. But all the sites of the Rappahannock Regional Library should have test kits available. They're the type of thing where you can come by, they'll drop them off, put them in your trunk or your car for you, and you can drive home and use the internet to do your test strip and everything like that as far as the antigen tests go. And we'll have that information on our website. We'll talk again soon. Thank you.